Okay, thank you very much. And our group was mainly, well, first of all, the precision medicine was chosen here because we thought that it's important to know that it's not only ICT technologies that are transforming the healthcare, but it's also the medical science and the biological advances. However, our group was still mostly talking about data, like the other groups, because most of the people here are still from the ICT background. Our group was 20 people or so, and we had a very good discussion. We were very visionary, but the downside of being visionary is that then getting to practical actions is difficult in a short time frame. However, we have two suggestions now for this. The first one is on diagnostic side. We used the template that was given to us here and tried to fill in. The name is of the first idea is self-care diagnostic pathway for preventive care. And here the focus was, of course, on home measurements, but also on quality of data so that it can be actually used in clinical practice. And also that it has to be versatile enough. So if you're making some measurements, producing some data outside of the clinical sites, then it has to be of good quality, but also you have to have access to multiple data sources. And we didn't have all the stakeholders in the room because we were only 20, but however we listed some companies that we think who should be in this, in working on this. So of course we had the public side here, STM and THL who are on the preventive, working on the preventive side. Then we have the startup community. We have a number of startup companies who actually are working on self-tests and diagnostic tests for consumers. We had Vivago in the room. They are interested in continuing this, as well as Lab Quality, name of the company, and she had to leave, but she would be willing to continue working on this case. Then we identified the bigger players, Terveystalo Mehiläinen, who should be interested in this. Healthy, of course, being the challenger in terms of the operation mode. Velmo also could be interested, and Nokia with their new approach in this field. Okay, we started working in the concrete actions. We thought that maybe it's the first startups. It's the game of the startups, building the tests, making the tests, offering them to consumers, and then the bigger players will come in later. And then slide 4, please. Can you move on to slide? Yes, here is. And the other one I see that was more or less same what Matti actually explained. So we had also this Ihana case. Basically, there was a problem identified from our clinical participant that actually the data is not, the data whatever exists, it's not in clinical use. So there are problems in producing, collecting, organizing and correcting relevant data in clinical use. So we have great visions, but the practicalities are very different. So then there was idea that, okay, maybe we should generate a My Health data bank account so that the data could be available through the individual. Benefits would be, of course, better and more precise diagnosis and treatment. There would be data for research, and when there's research and development being done on data, then there will be also business. The team, the stakeholders who should be working on this, we had CSC representative there. We think, okay, CSC could be a partner in this. Of course, STM and THL. Then we thought that the bigger guys who are already in this business, they should be working on this. So CGI, Tieto, Nokia. Then the hospitals, we have a huge Apoti project going on. So that project and the subcontractors who are contributing to that, they should be interested. Of course, the startup community, and then the various hospital test beds that we have in the country. The actions, okay, we are opening the databases. We know that the databases are opening nationwide. There are standards already, but there should be somehow that the standardization and the unification continues and is taken into use. There could be data sandboxes, so places where the data is organized and corrected, which companies could then work on. And then there finally should be some analytics development on the data. So that's how far we got in these 2 times 40 minutes that was given. Thank you.